We'll just jump on in. Okay, so thank you so much for coming to this session. Jersey Roots Global Reach, how engaged research on age-friendly communities in New Jersey is bolstering the movement. My name is Natalie Pope. I'm a third year doctoral student at Rutgers University School of Social Work, and I'll be leading this session along with my mentor, Dr. Emily Greenfield. There we go. Okay. And so we want to begin kind of situating what we're doing here at Rutgers on age-friendly research, both within New Jersey, locally, statewide, as well as internationally. So we want to highlight kind of what's going on in our own backyard on age-friendly research innovation. And as this quick little diagram shows, there's several hubs across the world in the US, Canada, Europe, East Asia, and Australia. And Rutgers is one of the big players on that international scale. So as we go through, we want just to have this visual guiding us in terms of what we're learning very deeply is embedded here in New Jersey and has real local impact, but as well is leading on the international stage.
Great, thanks. And I'll chime in here. So again, I'm Emily Greenfield, and I'm a professor in the School of Social Work. We sit under the New Brunswick Dean, and I've been on faculty since 2007 and been doing work on community-based social innovations for aging really since 2010. And the work on age-friendly community initiatives started to warm up in 2015 and then really got going in 2016. So our program of research started in this space. Actually, I started my own work on this, writing about age-friendly community initiatives, just looking at literature, kind of the global literature on age-friendly communities. And we're fortunate, with private philanthropy with interests in aging and community, they were looking to do work together to make strategic investments to better support aging in place. And in conversations, it worked out that they were able to create this kind of groundbreaking grant-making program in northern New Jersey, which aligns with these two philanthropic organizations' catchment areas, to spur the development of age-friendly community initiatives. At the time, we had an initiative in Montclair, an initiative in Princeton, working directly with the National AARP office in large part. But otherwise, New Jersey was kind of like a under the radar, a desert, not a lot of uptake of this innovative approach. And so private philanthropy really invested, not just financial dollars, but also a lot of other types of support to launch these initiatives in municipalities that raised their hand and showed readiness to do it. So the Rutgers School of Social Work, we were involved from the outset as what we call the developmental evaluators. So developmental evaluation, is when a program model isn't really well understood or it's new and emerging and you're kind of making it up as you go along. Perfect to describe age-friendly community initiatives, especially in 2016. And so we, over those years, were doing pretty much annual interviews with the on-the-ground community leaders to understand how they were using their time and resources to make age-friendly progress across multiple domains. So when we talk about domains, it's services, it's also the built environment and inclusion and respect for older adult community members, kind of following from the World Health Organization's framework. Since 2020 in particular, our work has really become more multifaceted and formal beyond the evaluation role. We found that because this work is so new, there's a real need to translate it back in real time to the practitioners that were receiving the grant funds and now to a growing body of people who are interested in engaging with this work. And so our engaged part and the teaching part, really, Rutgers, as a university, we do research, teaching, and service. And so this work really entails all three elements of that. So in 2020, we were fortunate to get a small internal award to partner with Bergen and Somerset counties, doing a project on creating an age-friendly county mapping tool using GIS information systems. So that was the first time our team really did something with the counties. And that project really helped Bergen and Somerset County both join the AARP network down the road to formalize their own commitment to age-friendly work. And there's been statewide groups that have emerged, including the AgeFriendly New Jersey Collaborative, which Andy is going to speak about at a table at a different session. So we're included on that, the Age-Friendly Advisory Council under the governor, which is also a different table. So kind of moving up the systems levels while retaining that focus on the local municipal work. In 2021, we got a 2-year grant that formalized and to co-administer the Age-Friendly North Jersey Alliance. So this is what we call like a superstructure. It's a regional network of leaders who are doing age-friendly community work. And we're part of an interorganizational team that convenes participants in that network about once a month for peer learning. It's like a learning collaborative and coordinated action. And now in 2022, we have more expanding involvement on the state level, while again, continuing that study that started in 2016 to understand the long arc of the local leaders' work in their own communities.
Thank you, Emily. So we wanted just to highlight real quick kind of some of the outcomes, the outputs that we've done here with this deeply embedded work here with the age-friendly communities in New Jersey. Just to highlight, we've done over 14 conferences across the country. We've done 3 community reports spanning getting started, implementation aspects, and kind of looking back on a multi-year kind of progress reports. You know, what did the initiative's organizational structure look like? What was their leadership and their partners and their budgets and sustainability projections? These reports have a community practitioner audience, and they are available. We'll be sharing the link to that here in a moment. They're available online, I should say. As well, we've done 5 academic papers as a research team here, and related to really similar topics. So things on the logic model implementation aspects of age-friendly initiatives, the role of older adults in age-friendly work, the types of activities and partnership relations between age-friendly initiatives and their partners, the role of age-friendly initiatives during the early phases of the COVID-19 pandemic, and then looking deeply at specific aspects of age-friendly practice, like such as events and how that relates to sustainability. I think, Emily, for you.
Yeah, so this is a screenshot of a web page that we have now under the Age-Friendly North Jersey Alliance website under publications and resources. It's a digital library with those academic publications, reports, a report from one of our statewide colleagues that, you know, it's kind of like a one place you could go if you're interested in reading abstracts, and if you're interested in receiving copies of any of these materials that aren't available in the public domain yet, there's an email address and we're happy to send you PDFs. Moving forward, we're going to try really hard as a team to budget to have open access publishing for this work, because we're really writing these academic pieces not just to other academics. Yes, they're a big part of the audience, but you know, to actually make change, you need the engagement and capacity development of people across all sorts of sectors, well beyond other, you know, academic actors in higher ed. Yeah, that's something we're going to aspire to in the future. But in the meantime, do not be shy. If you or any of your partners would like access to these papers, we're happy to send you a complimentary copy by email.
I think this first part's for you as well.
Yeah, right. So just one slide to summarize 6+ years of work and going just really fast. And we want to make sure there's time for discussion here before we finish up at, I think, at 10:10. So yeah, we've been able to take a deep dive into articulating key aspects of age-friendly community practice. You know, a lot of the formal discourse from World Health Organization, AARP, and others has been focused on kind of like, what's the idea of an age-friendly community? What are characteristics that make a community age-friendly? But historically, there's been very little on like, how do you actually do anything about it? Like, how do you use kind of like theoretically guided practice to take your best chance of making meaningful change? And so because, you know, we've been in partnership with this network of local leaders in northern New Jersey that are philanthropically supported, we've been able to really learn from the practice leaders on the ground kind of key elements of their practice and articulate that. So I'll just give one example of this list. Natalie and I recently published a paper in the Journal of Community Practice talking about community events as a tactic. You know, events are kind of mentioned in like the gray literature, and when people talk about like what is age-friendly all about, like intuitively practice leaders do these things, but no one's really articulated like how are events a strategy toward longer term change. And so we used qualitative research methods and the voices of the practice leaders to really pull out the multiple ways in which events are helpful for building a movement, especially at the local level, toward like raising the visibility of aging in a community, forging new relationships and partners, giving space for older residents to be involved and engaged on their own terms in meaningful ways. Like events have kind of lots of different ways in which they can be useful. And so we were able to use the power of research, collaborative research, to be able to spell that out.
And going to the second bullet here on the slide, what's kind of exciting, thinking back on where the research has been so far with our team and where we're looking to go moving forward a bit, is kind of bringing this together and reconceptualizing what it is an age-friendly community initiative might be in our eyes and in our network. So more than so much a limited programmatic effort working on one project here, one project over there, we're increasingly appreciating that age-friendly initiatives are building community capacity to maintain and sustain age-friendly work and change. And so kind of with that point, we're looking at this idea of intentional network interventions. And so again, rather than it being a program over here and a program over there, isolated programs, both within an initiative and then across initiatives, rather, we're increasingly appreciating that these are efforts intervening at the relational networks or sinews in the social fabric of our communities. And that's kind of the magic sauce, if you will, of these age-friendly initiatives. And that we're also appreciating that the specific elements or components of an age-friendly initiative need to be seen really within the larger whole of the efforts, both within the initiative and then across initiatives as part of this collective movement building effort. And then two, finally, really the importance of coupling a top-down with a bottom-up approach, such that while it's incredibly critical and necessary to have local investment in these efforts, it's not fully sufficient, especially when we start looking to the long-term aspects of sustainability and scalability. For those long-term components, we really are seeing that the importance of that dual top-down, bottom-up approach. And getting toward the end here of our prepared comments, we want to highlight our translational work. In addition to the research efforts and the research outputs and insights that we're garnering, we want to highlight that this research effort is in constant dialogue with our practice and policy translational efforts, and that they're both simultaneously reinforcing the other. And just to highlight a couple, some of which we've already touched on so far. One is the Age-Friendly North Alliance initiative that we help to oversee. Another one coming to you quite literally at the moment is the Age-Friendly Virtual Fair. And as well, our team has presence on the Age-Friendly Advisory Council and the Age-Friendly Statewide Collaborative. And small shout out, several of these efforts do have their own specific sessions later on today. And so you see the numbers here, and we can also share those with you all later if you're interested in learning more.
Yep, and I'll just say, we are part of a School of Social Work, so this work feeds back into our training of future workforce, especially leaders in community-based services and in healthcare organizations. And so we constantly update our curriculum to reflect what we're learning and have a strong emphasis on leadership in our MSW program in aging, given that we're studying leaders in action at all these different system levels. And we're very proud and humbled to be able to be part of a growing network of national and international networks. Happy to speak more about that if people are interested, but just one example, we have a new partnership with AARP and their affiliates of the World Health Organization that does a lot of work in the Americas. So it's a kind of North America and South geographically, all the countries, that region of the globe, and working with them to translate research conducted by a different academic team into training materials for public sector leaders to better understand the multi-sectoral collaborative elements that are so critical to age-friendly community change. So that's just one example of how our own experiences of doing research on age-friendly work in New Jersey, as well as being part of multi-sectoral collaborations ourselves as part of higher ed, is helping us to partner with the global movement, and hopefully for the benefit of us all. So Natalie, maybe we can just advance the next screen quickly. Yep, here's our contact information for myself and for Natalie, as well as for Althea, who's a critical member of our research team as well. I think we should maybe stop the slide share. We have about 5 minutes. And I don't know if people are able to turn their video on so we can see you for our discussion part, if that's possible. Totally understandable if you're in a context that won't allow for that. And if people want to raise hands through Zoom or just go ahead and unmute, we really want to hear. Thanks, Emily, for the virtual applause. What elements you're interested in knowing more about? Happy to talk.
I'll just say hello. I just joined the conference just to kind of see what it was all about. I'm a new executive director at Volunteer Guardianship One-on-One. And we're a pretty small nonprofit hoping to grow. We're based out of Hunterdon County, but we're a community alternative to public guardianship. So and that's for somebody who is nobody else, who is losing capacity. So we train volunteers and match them in a one-on-one relationship. So I'd love to talk further about it with anybody who is interested.
Thanks, Julie. Yeah, one table that comes to mind that might be especially interested and kind of parallel to this, it's like another arm of our research that we didn't talk about, is on dementia-friendly communities. Dementia-friendly communities is this whole parallel, also global movement that we've done some, I think, groundbreaking work on the implementation of these things in the US context with our partners in Massachusetts, a state that's really ahead of the curve on a lot of these issues. And just starting to translate, like be in a position to be able to translate those findings back into the development of dementia-friendly community initiatives in New Jersey. So there's a team from Bergen County that's launching a dementia-friendly county initiative that is at another tabling session that I would encourage you to go to if you're interested in learning more.
And Emily, I'm not sure this is the one you have in mind, but there is one, session 2.3, becoming a dementia-friendly community. So if there's a different one that you had in mind, I'm glad to look for that.
Yeah, that's it.
Oh, good. Okay, so it's 2.3.
Thank you.
Morning, Sandy Fraser at the Community Foundation. I'd love to hear the two of you talk, and Natalie, I think you alluded to it, to what you're learning or understanding about how age-friendly communities evolve or work in practice between citizen-driven initiative and local vision setting and community planning driven by residents in their local communities, and the more formalized structures of government that often relate to the built environment domains in particular, and just where you see success or challenge in that work of, locally informed, community-led planning activity to help drive the agenda for the domains and local communities.
Thanks, Andy. Natalie, do you want to take a first pass or you want me to?
Well, I can just say that I think that's one of the strengths of the age-friendly movement, is that from the World Health Organization and then here in the US with AARP, there are some nice kind of guardrails, right? It gives you the 5-year planning cycle, and it gives you the workbooks and the structure. So you have some of that framework coming from that top-down approach aspect. So there is somewhere to start, at least. But then the movement is incredibly flexible. It can be really responsive to local needs and kind of not just the local needs, but also the way in which that type of aspect will manifest in a particular community. So that's not really asking into your question of challenges, but in terms of reflecting on what I appreciate about that mixture in the particular age-friendly context.
Thanks, Natalie. I'll take our last 45 seconds just to really quickly give the example that we wrote a paper on older adults' involvement in age-friendly community initiatives, and that was really inspired by the fact that people be like, oh, older adults need to lead these things. Well, what do you mean? What do you mean by older adults to start with? And what do you mean by leading these things? And so we were able to use the power of research tools and practice happening right in our own geography to really show the variety of roles that older adults can take on so that practice leaders can be more intentional and explicit of how older adults are involved in a given point and how they might want to up that involvement, or who might be missing, or who might be involved in some ways, but not others. And so we're hoping the research can help elevate and inform these very good questions on these tensions.